this is a lens which helps in the focusing. And this is the back of the eye where we have the nerve and we have all the blood and the fluid, which helps us to keep the eye nourished and also form a clear picture in the back of the eye, which is like a film that we have in the camera. So in a nutshell, you know, all the three parts of the eye, the front, the middle, and the back, they all have to be functional and they all have to be clean in order for us to be able to see nice and clear. So this slide over here is for one of the most common problems that we see in real life. And this is, I don't know if anybody could guess that, but it's basically dryness, when your eyes become very dry. And dryness can happen to anybody at any stage of one's life. And the most common symptoms that a patient will say in dryness is, oh, my eyes are watery, my eyes are red, they're really burning, I feel very sore. And most of the times, you know, the dryness can be because of too much of computer. It could be over medication. It could be out in the sun a lot. It could be because you're not sleeping well. And a lot of times patients will get confused between dryness and allergies. But the two big difference that we have between allergy and dryness is that in allergies, which is more common during the, you know, the summertime, is itching. You will constantly want to just itch your eye. It could be red, it could be watery, but it will be itching, it will be very itchy. But in a dry eye, you will have a lot more of redness and a lot more burning. So that's usually what the common symptoms are in dryness, and is basically because of the lack of the production of adequate amount of tears in the eye, which we have to control eventually. So this is something that most patients will be aware of, and this is basically a cataract. So if you look at the first picture, this is the lens over here, which is required for the focusing of the eye, for the accommodation of the eye. And if you look at the second picture, you see how cloudy it is. So this should be nice and clear for us to be able to see clearly, because if this is cloudy, then whatever we are seeing from here is not going to pass, the light will not pass through the lens, and the image being formed over here is going to be very blurry. So this is clear, and this has all this white stuff here, which is the cataract. And cataract is usually, most of the time, it's age-related, in which, you know, the cornea, in which the lens becomes cloudy. But it could be congenital. You could be born with it, certain medications, overdose of steroids, or an injury. They all can also cause cataracts. And the way to treat it is basically through surgery. So this is just a real eye, which I wanted you to see. Like if you see your eye in the mirror, and if you see, you know, that your eye seems to be like this, it's typically cataract, and it's very, very cloudy. And usually we will see the cataracts in patients above the age of 65, but I have seen patients as young as 40 also with cataracts. So it can happen, but most common, it's an elderly condition that we see in. So this is another thing, which is glaucoma, and I'm pretty sure most of you have heard about glaucoma. What happens is that in a normal eye, we have a certain amount of fluid over here that has to be drained. You see these arrows here? The fluid has to be drained adequately. If there is an obstruction in the flow of the fluid, what can happen is the pressure can build up over here, and as a result, the optic nerve, which is in the back over here, can get damaged. And that's what basically is, in a nutshell, glaucoma. So if you look here, how there's a buildup of pressure, the pressure is pushing back on the nerve, and where we actually see clearly, and once the nerve gets hit, the nerve can get damaged and it can cause trouble. There are different types of glaucoma, but the most common kind of glaucoma is the one that typically hits after the age of 40, 45, in which the pressure is high. And unfortunately, you know, you will never know you have glaucoma unless you go to a doctor's office and get your eyes checked and get your pressure checked and get your visual fields checked. You will never know. That's the most common type of glaucoma that we see. There are different types of glaucoma. There is another glaucoma in which the pressure can go skyrocketing high, and that will have symptoms, but that is at a very, very less common. Well, this one is, again, the normal eye, the back of the eye. So basically, this is the retina, and this is, give me 1 second, it's blocking something. Okay. So this is the optic nerve, and this is our macula where we see from, and these are all the blood vessels over here, which this is a very, very healthy eye, which has a very beautiful retina with lovely blood vessels and nothing going on. You have diabetes, or if you have blood pressure or any blood-related systemic disease, you will start having a lot of hemorrhages in the back of the eye. You see all these red spots? These are all hemorrhages. And the yellowing over here is when the macula, where we actually see from, is getting stretched. It's causing a lot of trouble, and your vision will get affected big time over here. So that's in a very, very small words, which is diabetes. This slide is macular degeneration, and I'm again sure a lot of people know about what macular degeneration is. This will usually hit after the age of 65 or 70, in which the macula, again over here, will go through degeneration. It's purely age-related, and too much of UV light can cause damage to the macula. And this basically is showing that, you know, your retina and your macula over here is getting pulled, and as a result, you know, your vision is getting affected. What typically happens in macular degeneration is your central vision is going to get affected big time, and you will start seeing kind of spotty vision, blocked vision, in comparison to glaucoma, in which your peripheral vision will get affected first. So there are two different things. In glaucoma, it's central, and in macular degeneration, it's central, and in glaucoma, it's peripheral. So they're two different things. But in macular degeneration, you will definitely have the symptoms, but in glaucoma, unfortunately, no symptoms unless you go to the doctor's office. So this is something that we give to our patients, and it's called an Amsler's grid. And I recommend this to all my patients above the age of 65 to have it in their house. Basically, what this does is it helps you identify if your vision is being affected because of macular degeneration or anything going on in the back of the eye or the macula. What you have to simply do is you post it on the wall, and you have to stand at like arm's length. You can put your glasses on because you won't be able to see clearly if you have reading glasses. You just have to cover one eye, and you have to look at the black spot. Looking at the black spot, you have to try and see if all the lines are straight, if they're distorted, if there are any black spots in different squares. And with the pen in the other hand, you just have to mark those areas. So if you did the right eye, you know, you will be checking with the your left eye is blocked, then you're going to do it the other way. So that way, you know, you will have both the charts available for your right and for your left, and it will give you a very good idea if anything is going on in the back of the eye. And I would suggest that, you know, do it at least once a week. But if you have been diagnosed with macular degeneration, then you have to do it on a regular basis. Just some simple take-home points. Very important to know your family history if anybody has diabetes, blood pressure, or any retinal issues. Good nutrition is very, very critical. Eat lots of greens, spinach, carrots, fish, lots of fruits. You gotta limit your screen time, and this applies to kids, children, and everybody, because the screen has a lot of blue light that it emits, and that is very, very harmful for your eyes. Sunglasses is a must with 100% UV protection, because the UV rays will be harming your eye. It can cause macular degeneration, it can cause cataracts, it can make your eyes go yellow. So sunglasses, I would definitely say, is a must. Regular eye exams, yes, we all need to do that on a regular basis, and it all depends on the age. And if you have been diagnosed with any conditions, then your eye exams have to be done accordingly. Vitamins, I just listed a few vitamins over here. This is one of the most common ones for the eyes. It's Ocuvite, eye caps. Preservation is very good for macular degeneration because it will help filter the blue light, which can cause, again, the degeneration. Ocuvite and eye caps are excellent vitamins over the counter. You can get them in Costco, and just once a day, and it basically will not regress what you've already had, but it can slow down the process of whatever you have, whether it's degeneration or whether it's cataracts. And lastly, I would say just laugh, stay happy, do a lot of yoga, take a lot of walks, be in nature, because that all really helps.